Okay, so I'm Jordan Hendershot,
I'm Rebecca.
and we're going to be talking about undernutrition in college students. So what is undernutrition? According to our ward law book, it is failing health that results from a long-standing dietary intake that is not enough to meet nutritional needs. So today we're going to be talking about undernutrition in college students, and in particular eating disorders, and the two main ones that we're going to focus on are bulimia nervosa and anorexia nervosa. So just to start off with a few statistics, these come from the Multi-Service Eating Disorders Association. 15% of women 17 to 24 have eating disorders. 1 to 7% of men in college develop an eating disorder. 20% of college students said they have or have previously had an eating disorder. And 91% of female college students have attempted to control their weight through dieting. So you can definitely tell that it's more prevalent in women, but men also struggle with this as well. And then within Mounts campus, there's approximately 2,200 students. And if you take 20% of that, that's 440 students that could be struggling with an eating disorder. So if you take a look at it, it's really prevalent in college students.
So why college students? So when you go to college, you're making new friends, you're joining new peer groups, and there's definitely a pressure to fit in, to be thin. There's a fear of freshman 15 gaining weight. Dorm living, most dorms don't have refrigerators or stoves, so that makes it harder. Academic and financial stress, and like cafeteria eating. Okay, so the first eating disorder we're going to be talking about is bulimia nervosa, and as described in the ward law book, it is an eating disorder in which large quantities of food are eaten at one time and then purged from the body by vomiting, misuse of laxatives, diuretics, or enema. Alternative means to counteract the binge behavior are fasting and excessive exercise. To be diagnosed with bulimia nervosa, you have to binge and purge at least twice a week for 3 months.
So some of the effects that bulimia nervosa has on the body, we talked about this a little bit in class, but these come from the nationaleatingdisorders.org. It can cause an electrolyte imbalance, and this leads to irregular heartbeats, and then in extreme cases this can lead to heart failure and even death. This is caused by dehydration and loss of potassium and sodium from purging, and then also from frequent vomiting can cause inflammation and possible rupture of the esophagus, and then also tooth decay and staining from the stomach acid. And it can also cause chronic irregular bowel movements and constipation, and that would be as a result of laxative abuse.
Okay, so the next eating disorder we're going to talk about is anorexia nervosa, and as defined in the ward law book, it is an eating disorder involving psychological loss or denial of appetite, followed by self-starvation related in part to a distorted body image and various social pressures commonly associated with puberty. To be diagnosed with anorexia nervosa, you have to weigh less than 85% of your standard weight and miss 3 consecutive periods. And by standard weight, it goes by the hand-weight equation.
And then some of the effects of anorexia nervosa on the body, again, we covered these in some of the slides. This also comes from the mayoclinic.org. It can cause low body temperature and cold intolerance, and this is due to the loss of thyroid function. Then a low thyroid hormone also leads to slower metabolism. It can increase your susceptibility to infection, and this is because you're not getting enough protein in your diet, which is leading to low antibodies and a decreased immune system. And then it can also cause different GI complications, so bloating, abnormal fullness, and then constipation. It can also cause decrease in irregular heart rate due to an electrolyte imbalance, and then also an absence of menstruation, and then iron deficiency anemia.
According to mentalhealth.net, there are 3 main biological causes of eating disorders. There's genetics, personality traits, and then neurological causes. Genetics contributes to about approximately 56% of the risk for developing an eating disorder. Individuals who have a mother or sister with anorexia nervosa are approximately 12 times more likely to develop anorexia and 4 times more likely to develop bulimia than individuals with no history of these disorders. Some common personality traits with people with this disease, with eating disorders, are competitiveness, perfectionist, people that are obsessive and compulsive. And then some neurological causes are, studies show that abnormalities in the structure or activity of the hypothalamus have been found to affect the feeling of being full after eating.
So some of the psychological causes between these both disorders, a lot of them are the same. So anxiety, depression, low self-esteem, a distorted body image. So some of those are really the same. Some of the ones that are different are people with bulimia. They're aware that they have an issue and they're kind of embarrassed by it and they try to hide it. And then people with anorexia nervosa, they're not aware that they have an issue. They don't see anything wrong with it. They're kind of in denial and they resist any sort of treatment or counseling. And then another one, it's under anorexia nervosa, but it could be under both, would be trauma. So this would be like sexual or physical abuse, as well as any kind of bullying. So it's really shown that people that have experienced some kind of trauma are likely to develop one of these eating disorders. And then going on with that, there are social causes. The main one being media. I think we can all attest to the television, magazines, social media, websites. It really portrays thin as what's attractive, so it really causes a distorted body image and a really black and white way of thinking. So thin equates to good and fat equates to bad. And then also pressures from friends and family to be thin would also be a social cause as well.
So according to nationaleatingdisorders.org, there are quite a few warning signs for bulimia and anorexia nervosa. For bulimia nervosa, you may find like presence of like a recent binge, such as like somebody hiding food or like a lot of like wrappers or empty food containers. You may also find evidence of a recent purge, such as like the breath smelling like vomit, discoloration of their teeth, calluses on the back of their hands, and like noticing somebody going to the bathroom often after eating. And then the signs are a little bit more obvious for anorexia, such as like dramatic weight loss, obviously, somebody who's constantly counting calories and dieting, somebody you notice that never really eats and denies ever being hungry, someone who withdraws from your friends and like hanging out.
Okay, so some of the solutions for college campuses for this issue, one would be to form a body image or eating disorder group that's run by students or faculty members. And another would be to promote as many food choices as possible in the cafeteria and healthy food. So fresh fruit, salad, and soup bar, deli, pasta bar, different foods like that. And then also to make sure that there's an on-campus dietitian that's available, as well as counseling and health services staff. So the main goal is kind of to create more of an awareness and educate students and faculty on this issue, and then also to provide a place for students to go that are struggling with this. And those are our references.
Okay.